Hello, my name is Dr. Chinmoy Roy. So I am from Rajarhat Pain Clinic. We are seeing a lot of patients of headache. So one common topic today I want to discuss with you. So here the topic is headache and sleep hygiene, or you can say headache and relation with sleep. So common question is that is there any relation between sleep and headache? So my answer is yes. It is a very close relation. Both too little sleep or too much sleep can trigger headaches. And of course, poor sleep quality affects our brain's pain control centers, and of course, it alters the neurotransmitter balance, so makes us more sensitive to pain. And there are some conditions like, say, migraine, tension headache, cluster headache. They are very much strongly related to the disturbed sleep patterns. So what are the types of headaches that are most commonly associated with the sleep problems? So mainly the main types of headaches, as you know that all headaches are of different types. One is tension type headache. So it increases with stress, or say poor sleep, and fatigue. Fatigue also is one of the causes. Next is migraine. So it is often triggered by irregular sleep or lack of rest. Third is hypnic headache. So this is a rare type of headache that wakes you up from sleep, usually in older adults. And then fourth type of headache is cluster headache. So then comes morning headache. So these morning headaches are actually, they are seen in those people who suffer from sleep apnea or bruxism. Bruxism means teeth grinding during sleep. Many people make sounds while at sleep, teeth grinding sounds. So they can have morning headache. So you can see that different types of sleep pattern can cause different types of headache. Relation with headache is there. Now another question can be, then what is actually sleep hygiene? When we talk about sleep hygiene as a type of treatment, or everyone should maintain, this is advice given to every headache patient. So sleep hygiene refers to the set of habits and practices that promote good quality sleep and alertness during the day. So patients should be alert during the day, and at night the sleep should be very good. So it includes going to bed and waking up at the same time daily. But this is the first point. Then comes avoiding the caffeine or heavy meals before bedtime. So dinner should be light, and you should not take caffeine at night. And reducing screen time, and or say blue light exposure. So this is also third habit, you can say. So then you have to keep the bedroom dark, quiet and comfortable. Everyone's bedroom should be comfortable. It should be help in inducing the sleep. And then another point I can say, that avoiding alcohol and nicotine close to the bedtime. Okay, so these are some advices, or some say good quality habits, which collectively the name has been given as sleep hygiene. So another question is can be asked, that how can lack of sleep trigger headaches? So commonly lack of sleep actually increases the stress hormone, like say cortisol, and decreases pain inhibiting chemicals in our brain. There are some pain inhibiting chemicals. So ultimately this imbalance makes the nerves more sensitive and can lead to, ultimately it can cause the tightness in head and neck muscles, which causes the, mainly it is the cause of the tension type headache. Of course there can be some change in our blood vessels, like it dilates, so blood vessels also can become bigger, and there is changes some of serotonin, there is a neurotransmitter in our brain, so it also can cause headache. Mainly it is related to the migraine type of headache. Then morning headache, as I told, just due to bruxism, or if the sleep apnea is there. So it is actually due to poor oxygenation, and that is due to the disturbed sleep. So someone can have morning headache. Many patients, they will say that my work time is such that I sleep late because of work. So do you think that that just changing the sleep timing will help to relieve my headache? So answer is that yes, you should try to go to bed in the right time. It is even a constant bedtime always makes a big difference. Your brain and body work in a natural rhythm, which we call as circadian rhythm. So disrupting it, for example, by staying awake till late night and sleeping at irregular hours, can cause fatigue, irritability and headache. So it is always better to make a fixed sleep schedule and go to the bed early. And of course this will actually regulate your hormones and will reduce the headache frequency. So and another question, this is like can sleeping too much can cause headache also? So this is also surprisingly, I mean, the answer is yes. Oversleeping also can change blood flow to your brain and alter some serotonin levels, and it can also cause some neck stiffness from lying in the bed in one position for a long time. So many migraine patients report headaches after weekend oversleeping. So it is called as weekend headache. Okay, as I told you that already, that what is the sleep hygiene. So these sleep hygiene advices you must maintain for a good I mean, so that you do, if you have headache, so that for treating the headache part. So all headache patients must abide by the good habits of the sleep hygiene advices. So what are those? So one is go to bed and wake up at the same time daily, even on weekends, and then create a calming or bedtime routine, like dim lights you can use, or it should be dark and comfortable situation when you are environment when you are going to sleep. There should not be a clock in front of your eye which should tell you that okay, what is the time. Every time you should not think that okay, maybe I am late, nothing like that. Then avoid screens, it is the most important thing. At least 1 hour before sleep you should stop using the screen, at least 1 hour before sleep time, before your fixed sleep time. Then don't take caffeine, nicotine or alcohol in the evening time, at least not up to late night. Then avoid heavy meals or excessive fluid late at night. Then exercise regularly, but not close to bedtime. Okay, use your bed only for sleep or relaxation, not for work or scrolling through the phone. So that is also very important. Then so can improving my another question, it can be that improving sleep hygiene reduce my migraine attacks? So of course as I told you that in every headache patients, maintaining sleep hygiene is a must before you start all types of pharmacotherapy, tablets and all. This sleep hygiene should be maintained. And now how much sleep do we need? So it is like 6 to 8 hours good quality sleep, okay, each night at the fixed time. It is not that someday in the daytime you are taking 8 hours sleep and someday at night. It is not like that. It is at the fixed time each night, 6 to 8 hours of good quality sleep. That is at the least amount of sleep is needed. Remember, my advices in headache, in sleep hygiene are not substitute to any doctor consultation. because you should not diagnose it yourself thinking that okay, my headache is due to the disturbed sleep or the wrong habits of sleep, so I will correct them and I will become all right. So you cannot say that. Whenever headache is too much disturbing you, you must consult a doctor. Okay, thank you.